I would like to start with the beginning of the inauguration ceremony. I would like to call Dr. Aflaq Rashid, Head of Department of Rheumatology and Immunology, Sheikh Zayed Hospital, Lahore.
Assalamu alaikum everyone. A warm welcome from Department of Rheumatology and Sheikh Zayed Hospital. We will start with our inaugural session. And before starting, I would like to request our guest of honors to come to the stage. I will call upon their names. First of all, I will call upon Professor Masood Sadiq Sahab, who is the Vice Chancellor of the University of Child Health Sciences. Please, sir, come to the stage. Then Dr. Masood Ahmed, Professor of Pediatrics. Please, sir, come to the stage. Deputy Dean of Sheikh Zayed Hospital, Federal Postgraduate Medical Institute, Professor Mona Aziz. Madam, please come to the stage. And Professor Ejaz Hussain Sahab, Pro Vice Chancellor of King Edward Medical University. Sir, please come to the stage. Professor Izaz Mand Sahab, my great teacher and teachers of teachers. Sir, please come to the stage. And, Sir Professor Tafazul, sir, please come to the stage. And Dr. Tariq Rashid, please come to the stage. Professor Sardar Fakhr Imam Sahab, sir, please come to the stage. And Professor Tajammul Chaudhry Sahab, who is Professor of Forensic Medicine, sir, please also do come to the stage. And Dr. Fayaz Ranja Sahab, who has been an ex-head of Mayo Hospital, sir, please also do come to the stage. And Professor Farooq Kamal Sahab, Professor of Pathology, please, sir, come to the stage. Please come. And Professor Sumaira Farman, sorry, last but not least, madam, please come to the stage. She is Professor of Rheumatology at National Hospital and Medical Center. Madam, please come to the stage. Now over to Ariba, she is going to proceed.
I would like to call seats. Thank you so much, our guest of honors, for joining us here today. I would like to call on stage Dr. Aftab for the recitation of the Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والتين والزيتون وطور سينين وهذا البلد الأمين لقد خلقنا الإنسان في أحسن تقويم ثم رددناه أسفل سافلين إلا الذين آمنوا وعملوا الصالحات فلهم أجر غير ممنون فما يكذبك بعد بالدين أليس الله بأحكم الحاكمين. मैं पनाह मांगता हूँ अल्लाह की शैतान मरदूद से। शुरू करता हूँ अल्लाह के नाम से जो बड़ा मेहरबान निहायत रहम वाला है। कसम है इंजीर की और जैतून की और तूरे सीना की और इस अमन वाले शहर यानी मक्का की। यकीनन हमने इंसान को बेहतरीन सूरत में पैदा किया, फिर उसे नीचों नीच कर दिया। लेकिन जो लोग ईमान लाए और फिर नेक अमल किए तो उनके लिए ऐसा अजर है जो कभी ख़त्म ना होगा। बस तुझे अब रोज़े जज़ा के झुटलाने पर कौन सी चीज़ आमादा करती है? क्या अल्लाह ताला सब हाकिमों का हाकिम नहीं है?
Jazakallah, sir. I would like to now request all our honorable guests to please rise in respect to the national anthem. Proceeding forward. The Department of Rheumatology and Immunology was established in 1999 when pioneer rheumatologist Dr. Tafazlul Haq Mahmood joined Sheikh Zayed Hospital, Lahore. Since then, the journey was dynamic, resilient, and full of action. It all initiated with the allocation of beds in the medicine department and OPD. As time passed, patient burden increased, along with the restriction of human resource and space. In 2009, CPSP approved the specialty of rheumatology, and the department became first to gain recognition in public sector hospitals across provinces. In 2012, the department got recognized for MD rheumatology training by Punjab University. In 2018, after affiliation with University Health Sciences Lahore, the department gained recognition from PMDC as well. The department now has a full week of OPD to serve its patients. Trainees, along with the captains, sail continuously to provide state-of-the-art care to patients involving new biological treatments. In 2017, a dedicated unit was commissioned, having 13 beds, infusion center, and a procedure room. To date, 24 postgraduates from the department are the feathers in the department's cap. The dedication of the pioneer and the team has led to today's sunshine across the country. I would now like to request Professor Dr. Mona Aziz, Deputy Dean of Sheikh Zayed Medical Complex, to please say a few words.
Assalamu alaikum. I welcome you all on behalf of Department of Rheumatology and Immunology, Sheikh Zayed Federal PGMI Lahore, in this conference, and it is an honor to have you all here. Okay. Rheumatology is an important super specialty which has emerged in recent 2 decades. And in fact, our hospital and institute is the first where this department has become well established over last 12 or 13 years, and it has gained recognition in both CPSP and University of Health Sciences for major postgraduate studies. The credit goes to our Professor Tafazlul and also to Dr. Aflaq Rashid, who are working hard day and night for improvements in our rheumatology department, and also for awareness among other specialties for this super specialty. Now, few words about another super specialty of this, which is a branch of rheumatology, that is pediatric rheumatology, which is upcoming, and I think it's the time when we need to produce consultants and specialists in the field of pediatric rheumatology also. Because in coming years, because of the addition of gadgets, devices like cell phones and PlayStations, there is minimized outdoor activity for children, which is leading to joints, bones, and muscle problems. And also the indiscriminate use of immunization is leading to autoimmune disorders in the younger percentage of the population. So I think that the future is of rheumatology and also of in this field of pediatric rheumatology. Thank you.
Sir Fakhar Imam, please say some comments. The mic is with you. Or you prefer to come here, that is fine.
Assalamu alaikum, and as usual, I am grateful to the organizers and particularly to Professor Tafazal for having invited me onto this stage and this conference. It's always been wonderful to be here. And then many of us who have gray hair have really seen, and they have been a part of history, like for example, when all this started off in one of the small side rooms of Mayo Hospital of West Medical Ward, and then slowly and gradually, today we now see this specialty having grown up so much. Similarly, there's been another change, which is a very welcome change. And Professor Masood, you would realize that there were days when the physicians would say that pediatrics is mini medicine, so why have pediatrics? Why have a separate paper? Well, the two questions are good enough in final professional examination, and that is all. And then you and I are a part of that history also, where we have seen that not only that the field of pediatrics grew, but today those from adult medicine are actually holding a conference dedicating it to pediatric rheumatology. So that's another wonderful change that we have seen over the years. I wish them luck, and at the same time, there's another great personality whom we are missing on the stage. He has always been with us whenever we held anything which was related to education or so, and that is because he is not feeling very well these days, and that's Professor Mahmood Ali Malik. Whereas we not only miss him, I would request you all to pray for his well-being and for his health also. He's taught many of us, and we know that people who have taught one another, for all teachers, and particularly of senior teachers, that they hit at eternity. They or anyone else don't know where is it that their influence will stop working. So all of us, whether we are here on the stage, sitting there, people like Professor Salat and others, they're all great people. And though it might look out of tradition, but for those who are sitting here and for those who are not here for any reason, may I please request you to clap for them for a few seconds. And thank you very much for being with me. I'm grateful. Grateful once again, sir.
Sir Fiyaz Ranja sir, please.
बिस्मिल्लाहिर्रहमानिर्रहीम नहमदुहु व नुसल्ली व नुसल्लिमु अला रसूलिहिल करीम व नऊज़ु बिल्लाहि मिनश शैतानिर रजीम बिस्मिल्लाहिर्रहमानिर्रहीम। बड़ी अच्छी कॉन्फ्रेंस का इनेकाद किया है और माशाल्लाह एक ऐसे सब्जेक्ट को उजागर किया जा रहा है जिसके बारे में बहुत कम लोगों को इसके इम्पैक्ट का पता है। जब अल्लाह ताला ने मुझे अपने करम से डायरेक्टर जनरल हेल्थ पाकिस्तान बनाया तो 2-3-4 काम जो अच्छे मुझसे हुए उनमें से एक ये भी था कि मुझे बड़ी परेशानी होती थी कि बाकी जो बीमारियां हैं सारे सब्जेक्ट अपनी अपनी जगह पे अहम हैं। जैसे एजाज़मंद साहब के जो मरीज़ हैं उनका ज़्यादा से ज़्यादा रंग पुस्सा होगा, लेकिन चलते फिरते आम लोग उनके महसूस नहीं करेंगे। रूमेटोलॉजी एक ऐसी बीमारी है कि जिससे आपका चलते फिरते इंसान एक ऐसा भद्दा इंसान मालूम होता है कि परेशानी हो जाती है कि इसको क्या हुआ, अच्छे खासे हाथ थे यूँ हो गए, पाँव हो गए। तो इस लिहाज से जितने ये सारे लोग रूमेटोलॉजी में आए हैं, और मैंने भी बतौर डीजी हेल्थ अपना इसको प्रायोरिटी नंबर 1 दिया, और थैंक्स टू प्रोफेसर मसूद, उनका नाम भी था मसूद सादक, से मुझे यहाँ भी प्यार है, लेकिन वो मसूद थे जो डो यूनिवर्सिटी के वीसी थे। तो सबसे पहले उन्होंने मेरी रिक्वेस्ट पर रूमेटोलॉजी डिपार्टमेंट को वहाँ बनी फ्लरिश कराया, अच्छा कराया, वो बड़ी यानी उन्होंने काम अच्छा कर दिया। अब भी मैं आपको सिर्फ इतना कहना चाहता हूँ कि आप एक ऐसा काम कर रहे हैं कि अर्ली डायग्नोसिस हो, प्रॉम्प्ट ट्रीटमेंट हो, तो जो डिफॉर्मिटी और जो एडजस्टेड लाइफ है सारी जॉइंट्स की, उसमें आप इतना बड़ा रोल प्ले कर सकते हैं कि आपकी वजह से लोग हेल्दी नज़र आएँ। तो अगले चंद सालों में मैंने जो अभी 2-3 साल में देखा है कि कैल्शियम, विटामिन डी डेफिशिएंसी और ये जो ऑटो इम्यून डिजीज़ हैं, इनकी अबंडेंस इतनी ज़्यादा है। और मैंने अपने तौर पर, अब तो मुझे अच्छा प्लेटफार्म मिल गया रूमेटोलॉजी सोसाइटी वाला, कि मैंने 2-3 लोगों को कह दिया है कि सर्वे करें। आप हैरान हो जाएंगे कि अगर ये रूमेटोलॉजिस्ट अपना काम इस तरीके से कर रहे हैं, करना जारी रखेंगे, तो इंशाअल्लाह हम लूली लंगड़ी कौम को एक सेहतमंद कौम बनाने में कामयाब हो जाएंगे। तो इसलिए मेरे ख्याल में जितने हैं यहाँ 2-3 तो ये बैठे हैं, और मुझे भी अल्लाह के करम से एक ऐसा मेरे पास ओहदा है कि हम इंशाअल्लाह इस रूमेटोलॉजी का जो आगे मैग्नीट्यूड है ना, मैग्नीट्यूड जो डिज़ीज़ का इंसिडेंस है वो इतना ज़्यादा है कि 2 किस्म के लोग आपको, एक तो एक्सीडेंटल जिनकी हड्डियाँ टूट जाती हैं, ये इंसिडेंटल डिफॉर्मिटी वाला काम है। इस डिफॉर्मिटी को रोकने के लिए रूमेटोलॉजी को नंबर 1 पे लाना पड़ेगा, वरना अगले चंद सालों में बहुत सारे लोग डिफॉर्म्ड लाइफ वाले होंगे। उनको रोकने के लिए आपका सारा मेहनत कोशिश जितने लोग कर रहे हैं वो काबिल तहसीन है, और हम इंशाअल्लाह आपके साथ शाना बशाना काम करेंगे गवर्नमेंट के लेवल पे और सर्वे कराने में, और WHO के लेवल पे इंशाअल्लाह हम अपना रोल प्ले करेंगे। बहुत मुबारक, बहुत शुक्रिया।
Well, that is one of also a goal that policy makers should also be aware and be present in our forums to understand and identify and can advocate us to the higher authorities. Thank you very much, sir. Professor Tariq Rashid, a professor of dermatology and essential co-opt of the rheumatology discipline, I would request Dr. Tariq Rashid to please say a few words about it.
Thank you very much, Professor Tafazul Saab, Dr. Flaq Saab, and the whole organization team for inviting me and arranging this great academic event. And it's always so rich with academics and learning that I always wish to attend this symposium, this seminar. And being a dermatologist, rheumatology is very much linked with dermatology, because we often see patients with connective tissue diseases like SLEs, dermatomyositis, and overlap diseases. So it is our keen interest to learn from you the various uses, the adequate and judicious uses of biologics, JAK inhibitors, and others in the management of such cases. And definitely it always helped us to improve our skills basically in the management of the diseases. And now, as I was discussing, as Professor Fakhri Imam Sahab has said, it's exciting that pediatric rheumatology is going to establish now. And this is great, I think, because we see patients with pediatric psoriasis, adolescents and children with psoriasis and suffering from arthritis. And then we need more expertise, more knowledge for management of such diseases. Wishing you best of luck. Thank you very much.
Your comments are mutual to our rheumatology as well as pathology is a very important subject related to our rheumatology, as multiple biopsies and things associated with it are very much closely related. So I would request Professor Farooq Kamal to please have few words in our session.
Assalamu alaikum. Thank you very much for to the organizers for inviting me over here. My comment is that I'm a basically histopathologist, and I wish with the development of this rheumatology, the burden of joints to histopathologists should decrease because of this targeted therapy and biologics. A few years back, we used to get biopsies of the tissues at the level where nothing can be done except the replacements. Another comment over depending upon or based upon my practice over the years, that we should always keep in mind in our country tuberculosis as one of the very common cause of joint problems in our population. I thank again to the organizers and congratulate them with such activities. The subject of rheumatology is highlighted and its importance is known to the people. Thank you very much.
Thank you, sir. Thank you very much, sir. I would request Professor Sumaira Farman, who is a role model for all of us in the field of rheumatology, to say a few inaugural words.
Assalamu alaikum. Thank you so much. मुझे एक चीज़ जो शायद सिर्फ प्रोफेसर तफज़्ज़ुल और आप जानते हैं कि शेख ज़ैद एक तरह से मेरा मैका है, क्योंकि मैंने अपनी मेडिसिन शेख ज़ैद से शुरू की थी और दिस इज़ व्हेन शेख ज़ैद खुला था बिल्कुल शुरू में. तो मेरी बहुत खुशकिस्मती है. उस वक़्त प्रोफेसर मोयुद्दीन होते थे हेड ऑफ़ द इंस्टीट्यूट, ही वाज द डीन आल्सो. और मैंने ऐसे ऐसे लोगों के साथ 1-to-1, क्योंकि वहाँ एक कंसल्टेंट और 2 रेजिडेंट्स होते थे. सो मेडिसिन में प्रोफेसर ज़फ़र इकबाल, प्रोफेसर शफाक कार्डियोलॉजी, प्रोफेसर ताहिर शफ़ी नेफ्रोलॉजी, प्रोफेसर अनवार खान गैस्ट्रोएंट्रोलॉजी, और ये सब नए अभी भी आए थे. हम भी छोटे थे, वो भी जवान थे, यू नो. सो इट वाज अ वंडरफुल टाइम और मेरा वो वक्त कभी भी मैं भूल नहीं सकती. 2-2.5 साल जो थे. So Sheikh Zayed is very, very close to my heart, and any activity that is affiliated with your institution has to be close as well. और बहुत मुबारक and good luck and best wishes to Children's Hospital for, you know, planning to start a training program in pediatric rheumatology. आप सबको पता है कि that is a thing that's very, very close to my heart. और किसी तरीके से भी अगर if I can support and facilitate, I'm here. And thank you for inviting me, and Professor Tafazzul and you and the organizers. Thank you. Good luck with the meeting.
Thank you very much, madam. And I would request Professor Tahir Masood Sahab, who is Professor of Pediatrics, to please say a few words.
Bismillahirrahmanirrahim. First of all, I feel deeply honored, and it's a great pleasure for me to be invited on this esteemed forum by the Department of Rheumatology, Sheikh Zayed, and the Pakistan Society of Rheumatology. I think these activities of continued professional development go a long way in furthering the knowledge in medicine. Medicine, as we all are aware, that it's a dynamic and ever-changing field. Medicine which we practice today is not the same which was practiced by our forefathers, by our predecessors, and shall not be the same which will be practiced by the future generations. Because of the fact that there are so many innovations we have seen in our own life, that the treatment modalities which we are having today, they are altogether different from those of in the past. It's very heartening to see that the rheumatology has grown, and rheumatology has been established as a separate specialty over the past 2.5 decades. It's not easy to develop these subspecialties when the response from your colleagues is not encouraging. It's always difficult, जैसे है ना इकबाल ने कहा था कि आईने नौ से डरना, तर्ज़े कोहन प्यारना, मंजिल यही कठिन है कौमों की ज़िंदगी में. तो ये this problem or this ordeal we have faced when we were developing pediatrics as a subspecialty or pediatrics as a specialty as recognized at the undergraduate level. There was so much opposition from our own colleagues, and and now you are seeing that how the Children's Hospital over the country has emerged. And there are pediatric subspecialties which are working, which are coming at the international level. So I think it's a great progress. And regarding the pediatrics pediatrics obviously is altogether a different specialty. Children are not mini adults. Gone are the concepts when this was believed that just reducing the dose would suffice and we can treat children. Now each and every field of pediatrics, starting from neonatology to infancy to children or adolescent, these are altogether different. I would specifically thank the rheumatology colleagues, especially Dr. Tafazzal, Dr. Sumaira Farman Raja, and Professor Nigat Mir for developing this specialty in pediatrics. In pediatric rheumatology owes a lot to especially Dr. Sumaira Farman Raja and Dr. Tafazzal Haq, and I feel greatly intended to them, and we owe a lot to our adult rheumatology counterparts. Thank you very much.
Thank you very much, sir. And I think so the words of introduction become dwarf in front of Professor Azaz Mansab. He's such an icon of nephrology, and rheumatology and nephrology are like chuli daman ka saath. Sir, please.
Thank you, Aflaq. I am humbled by your gracious comments. Thank you, and I thank Professor Tafazzal for inviting me to this meeting today, and I wish you all the best for this conference, and we hope that this rheumatology grows. We have a lot of common patients with the rheumatology, may it be vasculitis, may it be lupus, or is it non-steroidal anti-inflammatory drug use by the patients for long that causes renal injury, and patients with rheumatoid, patients who end up with rheumatoid arthritis and then eventually develop amyloidosis, and the use of biologics and use of cyclosporin and other CNIs in rheumatology. I think these are some of the areas that are common in nephrology and rheumatology. So we keep seeing these patients and we keep growing, and it is very healthy that we look at other specialities. For example, if we have a patient with vasculitis and comes with a pulmonary hemorrhage, we need to consult a pulmonologist, we need to look at a rheumatologist, we need to look at a nephrologist, and maybe other specialties also, like a stroke can develop and things like that. So all these specialties are now developing and growing, and thanks to all those people who are the stalwarts in developing these specialities. And this was not an easy task because of the personal sufferings that people had to go through while developing these specialities. It was an arduous task because you get, as Professor Tahir Masood has said, that you get resistance from other areas. Instead of getting support, you get resistance at times to develop your specialty. For example, this rheumatology was purely a baby of the orthopedic surgeons. But then when rheumatology developed, then some resistance could be there. Same with the case in nephrology and urology. So people who have stood up and worked hard against different odds to develop these specialties, they deserve a special appreciation for developing these. And I'm very glad to know that Professor Masood Sadiq, who is himself, struggled quite a lot in developing pediatric cardiology in this part of the country. He has now been able to develop the pediatric rheumatology group. So I think that will ameliorate the sufferings of the children with polyarthropathies. So with these comments, I would like to congratulate you and thank you for honoring me for this occasion.
Thank you so much, sir. Professor Masood Sadiq will be having a presentation at the end of the session. Professor Ijaz Hussain, Professor of Dermatology as well as Pro-Vice Chancellor.
Bismillahirrahmanirrahim. Thank you very much, Professor Aflaq Rashid Saab. I must congratulate Professor Tafazle Mahmood and Professor Aflaq Rashid Saab for holding this very successful, very well-attended conference. We witnessed the journey of dermatology, starting from the scratch, and now it is well-grown specialty, feeding rheumatologists, at least I think whole of the Punjab, Sheikh Zayed Hospital, and we hope so. The lesson from the history is, inshallah, pediatric rheumatology will also develop a specialty, and Children's Hospital under the supervision of Professor Masood Sadiq will be a nucleus, and it will provide pediatric rheumatologists to the whole of the Punjab, rather whole of the country, inshallah. Thank you very much, sir.
Professor Tajammul, Professor of Forensic Medicine.
Thank you so much, sir. I'm truly honored and humbled to be part of this great conference. Teachers, amazing colleague, amazing friend in the form of Professor Tafazul. So, thank you so very much, sir. You and your team has done wonders. And a message to the juniors is that in Punjabi they say, "Jinne puchya nahi, unne sikhya nahi." So these are the people sitting on the stage in front of you. They are the legends. They are the institutions. So my request to the juniors would be that please get hold of them. जहाँ आपको नजर आए, corridor हो, ward हो, hospital हो, इनके मुंह से एक लफ्ज़ निकला हुआ एक सुनहरी लफ्ज़ है. And wishing you all the best of this conference today, tomorrow, and always. And I'm truly honored and humbled. Thank you, Professor Tafazul and your team. Thank you.
Now I would request Professor Masood Sadiq Sahab to, sir, please come to the stage and introduce pediatric rheumatology.
Thank you. Bismillah ar-Rahman ar-Rahim. First of all, let me thank Professor Tafazul and Dr. Ikhlaq Rashid for giving this honor to pediatric rheumatology as the focus of this particular Congress, RheumaCon, today. I think I'm extremely grateful to them. Let me say that pediatrics in its own right is a universe of its own. It's like adult medicine, there is pediatric medicine, and you have adult disciplines and we have pediatric disciplines. We live in a country where 48.7% of total population is 18 or younger. And we have the third largest pediatric population in the world. We are fifth largest country in terms of population, but when it comes to children, we are the third largest in the world as third largest pediatric population. So I think the context of pediatric rheumatology relates to that fact as well. And we are extremely grateful to Sheikh Zayed Hospital in that context, because our journey actually was very much initiated and started by Professor Tafazul, because he trained our first pediatrician in the field of rheumatology. So I would request everybody to give a big hand to Professor Tafazul for his tremendous contribution in that context. I think we know that pediatric rheumatology is a specialty for last 7 decades, and globally there are over 6 to 7 million children who are affected by rheumatic diseases. If we look at the Western data, we have over 350 practicing pediatric rheumatologists in USA, more than a dozen pediatric rheumatology centers in UK, 16 centers already across the border. The 2 people who started pediatric rheumatology clinic at Children's Hospital way back in early 2000. And then our journey started. We had our first pediatric rheumatology seminar, then training of Dr. Samia Naz, who is sitting here, and I would request her to stand up because she's the first pediatric rheumatologist in the province. She was trained by Professor Tafazzul way back 2014, 2015, and then of course the journey went forward. We had our first international liaison with the Hospital for Sick Children, Great Ormond Street, and had a rheumatology conference only last week. Just to give you an idea, we are seeing a large number of patients in our children's hospital already. If we look at the last 2 years' data, you can see juvenile idiopathic arthritis, SLE, juvenile dermatomyositis, systemic sclerosis, vasculitis, and many other diseases which we see at our institute. Our pediatric rheumatology clinic sees 50 to 70 patients in their OPD. Over 2,600 OPD visits last year only. We have an independent lupus clinic, a juvenile idiopathic arthritis clinic, and you can see the number of children who actually need admissions, and they regularly hold MDT meetings as well. So lastly, I think what is the future of pediatric rheumatology? I think two fundamental things need to be understood. One, we need to have an outreach program. One center cannot cater for the rheumatological needs of this province or this country. And of course, we need to have a fellowship in pediatric rheumatology. We need to detect these patients early. Of course, assistance in maintaining continuous care, initial management by both pediatricians and adult rheumatologists, a close liaison, a timely referral, provision of information and counseling to these patients, and of course, to monitor disease activity and promotion facilitation of telehealth assistance. I think it's extremely important to understand that we need to develop this close network between pediatricians, rheumatologists, and then pediatric rheumatology at Children's Hospital to move forward in this regard. That's how we were able to convince the government to have the first University of Child Health Sciences on the globe. We are 1,300 bedded, one of the largest, rather second largest children's hospital on the globe. We have 26 clinical and 13 diagnostic disciplines, and this is going to be the 39th discipline at Children's Hospital, which pertains to pediatrics only. So with the help of adult rheumatology colleagues and of course pediatricians, we are going to start our fellowship program. It's going to be a 2 years pediatric fellowship program after FCPS, which will have a, depending which route you have come, if you have come from adult route, there will be a different training program, and if you have come from a pediatric route, there will be a different program. And of course, let me finish by saying that progress lies not in enhancing what is, but advancing what will be. That's what we believe in terms of pediatric rheumatology and all pediatric disciplines. Let me conclude by once again thanking the team at Sheikh Zayed Hospital for being the patron of our group at Children's Hospital Lahore, and we look forward to their continuous support, not only from Sheikh Zayed, but I think from the entire rheumatology team across the country. Thank you very much.
Thank you so much, honorable guests. Now I would like to call Professor Dr. Tafazzul Haq Mahmood and Dr. Akhlaq Rashid to please come and present souvenirs to our guest of honors.
Before we present the shields to our guests and respectable colleagues for their presence here as a token of appreciation, I would like to also thank them for coming here and saying so many kind words for the department as well as for myself, for which I'm really humbled. Yes, as Professor Azazman, Professor Masood Sadiq, and all others have said, that it is not going to be an easy task. It is going to be a difficult task to develop pediatric rheumatology, because it's not just the rheumatologist that you are requiring. It is also the specialists associated with the field of rheumatology that you are going to require, who should be familiar with the subject. Either they are pediatric nephrologists, either they are pediatric gastroenterologists, or whatever field they are in. They need to be on board before you start developing and progressing the field of pediatric rheumatology, because without any multidisciplinary approach, it's not possible to treat and manage these patients amicably. So with this, I thank you all.
Okay, so proceeding forward, I would like to request that without our allied health department, we would have been nowhere. I would like to call Madam Talat Aslam, matron of Sheikh Zayed's Nursing, to please come on stage. I would like to call our guest of honor, Professor Dr. Mona Aziz, Deputy Dean, Sheikh Zayed Hospital. Professor Dr. Tajammul Chaudhry. Professor Dr. Azazmand. Professor Dr. Sardar Fakhr Imam.